All right. Good afternoon, everyone. Today is Monday, December 28th, and as of right now, we here in Baltimore have had 30,986 reported cases of COVID-19. We'd like to point out that these numbers represent a 23% decrease in positive cases over the past 4 weeks. There are 363 people who have been hospitalized between ICU and acute care. Hospitals are at 85% ICU capacity at this time and 82% acute care capacity at this time. Unfortunately, we have lost 628 people to COVID-19 in Baltimore. While we're seeing the spread of COVID slow in some ways, we are nowhere near out of the woods. Our parents, grandparents, neighbors, friends, and family continue to contract and die from this deadly virus. And we know there are people out there with COVID-19 who aren't showing any symptoms that are putting people that they know and love and others at risk. I want to thank those who followed the health and safety guidelines over this past holiday weekend. It wasn't easy to make these adjustments. We all know that, but it was extremely necessary and life-saving. With New Year's Eve coming up, it is imperative that we continue to do everything we can to slow the spread of COVID-19, to keep our community safe, and so that we can start fresh in 2021. However you decide to bring in the new year, please wear a mask, practice physical distancing, and limit your gatherings to those in your household. And be reminded that gatherings are limited to 10 people. Now is not the time to throw a big party or celebration. We have to find new ways to celebrate and mark this occasion of a new year. And I know that we all are looking forward to putting 2020 in our rear view, but we have to do it in a safe way. Again, the difficult decisions we make will impact our ability to celebrate together in the future. I'd like now to bring up our Health Commissioner, Dr. DeRaza, to say a few words and give us more updates. Dr. DeRaza?
Good afternoon, and thank you, Mayor Scott, for continuing to lead and inform the public about Baltimore City's COVID-19 pandemic response. I'd like to briefly touch on what we're seeing with the COVID-19 case numbers here in Baltimore City. As Mayor Scott mentioned, as of this morning, we have lost 628 lives to COVID-19, and we are averaging about 4 deaths per day. We have had more than 30,000 cases in the city, and our latest 7-day average new case count is 208. This represents a 23% decrease from where we were 4 weeks ago, but is still higher than we've seen prior to our current surge beginning in November. We have seen our positivity decrease by about 2%, and our latest 7-day average positivity is 5.8%. Our hospital utilization rates are trending in the right direction, but still remain high, with ICU capacity at 85% and acute care capacity at 82%. While we are starting to see encouraging trends in our case counts and positivity, as Mayor Scott mentioned, now is not the time to gather in large groups to celebrate the holiday. I want to thank everyone who stayed home and celebrated with their immediate households during Hanukkah and Christmas. As we said in November for Thanksgiving, and again in the weeks leading up to this year's holidays, please continue avoiding celebrations with individuals outside of your household. Again, doing that places you and others at risk. The current executive order limits indoor gatherings to no more than 10 people and outdoor gatherings to no more than 25 people. In Baltimore City, we have reached widespread community transmission, which means, again, that gathering with individuals outside of your household carries a high risk that you could be exposed to someone with COVID. We know that COVID-19 thrives in settings where social distancing and mask-wearing guidance are not being followed. We know that family and social gatherings remain a high-risk setting for COVID-19 transmission. Not feeling sick is not a good reason to endanger yourself or your family, as we also know that up to 50% of people who transmit COVID-19 don't show any symptoms. This is not the week to throw away months' worth of COVID-19 harm reduction guidance. Please continue to avoid social gatherings, wear your mask, wash your hands, and practice social distancing. By continuing to follow this guidance and best practices, I'm hopeful that we'll be able to protect our family and loved ones during this holiday season. Thank you.
Thank you, Dr. DeRaza. I'll now bring up Commissioner Harrison to talk about public safety and what we have had over this past weekend, but also moving into the holiday. Commissioner Harrison.
Thank you, Mr. Mayor. We had a number of incidents over the weekend, the Christmas weekend, 2 homicide incidents and 4 non-fatal shooting incidents. Though we've had some information and we've had some success with our residents providing information to help us do better this year, we need more. And if anyone has any information about any of these incidents, please call us right away. You can call and you can do it anonymously through Crime Stoppers, and there is reward money available. So if anyone has any information about any of our incidents, the 2 homicides and the 4 non-fatal shootings, please call us or call Crime Stoppers, and you can do it anonymously, and there is reward money. Now, as we move into the New Year's Eve weekend, we want to admonish everybody that fireworks are illegal in the city of Baltimore. All fireworks, to include the sparklers, are absolutely illegal in the city, and our department will have a robust deployment strategy and will be on the lookout for those individuals violating the law. Secondly, shooting firearms in the air is not only illegal, it is extremely dangerous. Bullets come down with the same velocity as they do when they go up. It can harm and kill people, so absolutely do not do it. We will be out, and we will be out looking for those individuals who want to violate the law and put other people in harm's way. So just to admonish people that fireworks are illegal, we'll be looking for it. Shooting firearms are illegal, and we will be looking for it in full, robust deployment strategy. We want to keep everyone safe, and we want you to have not just a safe, but a happy New Year's weekend. And let's bring in the New Year the right way, the safe way.
Thank you, Mr. Commissioner. Now we'll take some questions. So we set them out for a 4-week period. As we get close to that period, Dr. DeRaza and I will be discussing it, and we will be making the decision based on where we are, based on the advice from the Health Commissioner and our other advisors. That's not going to change until we get to that point. So as I said earlier, these are encouraging numbers, but they're nothing to celebrate. We still have too far many people contracting the virus and spreading it and dying from it in our city. We will get to the point of discussing that. We are encouraged, but these are not numbers to celebrate by any means. Next question.
This might be better for the health commissioner, but I was wondering if we do see a spike for Christmas and New Year's, what might we see it, and what are you looking for as far as the timeline?
So typically you might see that spike anywhere from 5 to 10 days post-holiday. We saw a little bit of a bump, I don't know if you recall, post-Thanksgiving. So we would certainly be looking, 5 to 10 days post-Christmas, 5 to 10 days post-New Year's.
All right. Thank you, everybody.